ICPC, MI 224, Coding, Classification, and Terminology in Medicine, presented by Maria Teresa Macam RN and Winona De Jesus RN. ICPC stands for International Classification for Primary Care. For our introduction, ICPC is the most widely used international classification for systematically capturing and organizing clinical information in primary care. Formally recognized by the World Health Organization's WHO family of international classifications, WHO FIC, as a classification system for primary care. It is developed and updated by the World Organization of Family Doctors, WONCA, or International Classification Committee, WICC. ICPC is mapped to the International Classification of Disease or ICD. Ongoing cooperation between WONCA and the WHO FIC network exists for the revision of ICD-10 to ICD-11 and harmonization with ICPC. It is most commonly used by family doctors as they provide a sufficiently detailed level for reporting, analysis, and payment for healthcare services. Providers of healthcare, policymakers, funders, and researchers need to have information about the epidemiology of their communities, and they need to understand what is happening within primary care to improve health services. To use only diagnosis to describe the health of the population became too limited, especially in a world where people are getting older with an increase in morbidity and functioning problems with age. ICPC is available in different 19 languages: Catalan, Chinese, Croatian, Danish, Dutch, English, Finnish, French, German, Greek, Italian, Japanese, Norwegian, Portuguese, Romanian, Russian, Serbian, Slovenian, and Spanish. ICPC was used in primary care in 27 countries, few UN countries, but was reported as a mandatory standard in only 6 countries. All of these are located in Europe. For the brief history of ICPC, in 1972, Classification Committee of the World Organization of National Colleges, Academies, and Academic Association of General Practitioners, Family Doctors, or WONCA, or World Organization of Family Doctors, first met in Melbourne and agreed to have a classification specifically for primary care. In 1975, WONCA designed the International Classification of Health Problems in Primary Care, or ICPC, and published in this year. In 1987, it was published the first version of ICPC, or ICPC-1. In 1993, revised and published the ICPC-E, or the International Classification of Primary Care in the European Community, with a multi-language layer. In 1998, published the second version of ICPC, or ICPC-2. In 2000, released the revised electronic version, or ICPC-2-E. In the year 2003, World Health Organization recognized the ICPC-2 as a WHO classification for the recording of data in primary care. In January 2018, ICPC-3 project started and ran for 3.5 years. In December 2020, the third version of ICPC, or ICPC-3, was developed and published. It was revised by the ICPC-3 Consortium and the WONCA WICC. ICPC-3 Consortium consists of WONCA World, WONCA Europe, Radboud University Nijmegen, the Dutch College of General Practitioners, the Brazilian Society for Primary Care or General Practice, Agencia de Sistemas de Información Portugués de Santé, France, Ghent University and Agentschap, Zorg en Gezondheid, Belgium, National Institute for Health and Welfare, Finland, and a number of countries' international bodies, World Health Organization with observer status. In the year April 16, 2020, ICPC-3 was endorsed during the WONCA executive meeting. It is the most recent version.
Basic concepts. First is reason for encounter, episode title, symptom episode, episode of care. We'll talk about the first basic concept, which is reason for encounter. Reason for encounter. Patients normally start the consultation with a spontaneous statement on why they visit the health professional. It precedes the interaction and interpretation by GPs and patients. It is the literal expression of the reasons why a person enters the consultation room, translated into the ICPC code by the GP. It represents the need for care by that person. Reason for encounter is also known as RFE. RFE presented in the forms of symptoms and complaints. Example, fever, a rash, body pain. A problem in an activity. Example, I can't walk. Self-diagnosed diseases. Example, I have the pink eye. A particular intervention. Example, COVID-19 vaccine. For the second basic concept, episode title. Episode title, or the health professional's diagnosis. After physical examination, the health professional makes a diagnosis that indicates the care episode in which the encounter takes place. The diagnosis or the assessment is the physician's point of view. Coding health problems or episodes of care should be at the highest level of diagnostic refinement, for which the user can be confident in which meets the inclusion criteria for that category. Episode title presented in the forms of symptoms. Example, fever, a rash, body pain. Problem in activity or participation. Example, limited range of motion. Disease or problem. Example, conjunctivitis. Non-disease related care. Example, vaccination. For the third basic concept, it's symptom episode. Symptom episode. When the physician codes the episode of care as a symptom episode, this means the patient complained for more than one symptom within this episode. Example, reason for encounter RFE is tiredness. During history taking, patient appears also to suffer from dizziness, trembling, and fatigued legs. The physician judges these complaints to belong to each other and chooses to label that episode with the episode title, tiredness. Last basic concept, episode of care. Episode of care, or EOC, is the full spectrum of problems including organic, physiological, and social, managed by the provider are recorded in the form of episodes of care. The definition of an episode of care is a health problem or disease from its first presentation to a health care provider up to the completion of the last encounter for that same health problem. EOC consists of RFE from the patient and episode title from the health professional. If the episode consists of multiple encounters, then the episode title will be the last diagnosis of the last encounter. For an example, these are 3 encounters. The last diagnosis is disc prolapse. This will be the episode title. EOC allows for grouping of information over time. Healthcare providers can use this information to improve continuity and coordination of care. The ability to collect data using the EOC also creates more insight into the processes related to certain conditions over time, and so a greater understanding of what is needed and the associated costs. ICPC chapters. 19 chapters are core classification and 3 chapters are additional. This is what it looks like. On the left side, there are 19 core, and at the bottom are 3 additional. Chapter A1. Chapter A1 visits for examination, routine examination, family planning, prevention, and other visits. These are visits with no complaints or illness. An example at the bottom of the screen. There is also an inclusion criteria at the right side of the screen. And these are the SNOMED, ICD-10, ICPC codes at the bottom. Chapters A to W. Chapter B to W represent the localization of the problem and/or disease on a body or body system level. Chapter A, which cannot be classified to only one or more than two body systems. Example, fatigue, ASO4, and fever, ASO3, can be attributed to almost all body system diseases. Chapter A to W is subdivided into two components. S for symptoms and complaints, D for diagnoses and diseases. Next chapter, Z. Chapter Z, or social problems. A social problem is an issue within the personal environment or society that makes it difficult for people to achieve their full potential. Poverty, unemployment, unequal opportunity, racism, and malnutrition are examples of social problems. So are substandard housing, employment, discrimination, and child abuse and neglect. Chapter 1. Chapter 1 is Inventions and Processes. The principle is the core of health treatment closely related to quaternary prevention, action taken to protect individuals, persons or patients, from medical interventions that are likely to cause more harm than good. Examples are below. Chapter 2. Chapter 2 is Functioning and Functioning Related. For primary healthcare, selected subset of items from the WHO International Classification of Functioning Disability in Health, or ICF, which provide an overview of a person and a person in context approach at a certain moment in time. Chapter 2 and Functioning Related have self-administered tools. First is your Primary Care Functioning Scale, or also known as PCFS. The second is Arrêt de Travail Médecine Générale à partir de Classification Internationale de Fonctionnement, which is ATCIL. World Health Organization Disability Assessment Schedule 2.0, or WHODAS 2.0. Primary Care Functioning Scale, or PCFS, is developed with an intended population age group of 50 and above with multimorbidity. Especially within multimorbidity, the problems in functioning is often the more important focus of care. Arrêt de travail en médecine générale à partir de la Classification Internationale de Fonctionnement, ATCIF, has been developed for sick leave prescription. In many countries, sick leave prescriptions are frequently used in primary healthcare or general practices. Using the ICF for sick leave prescription instead of the traditional medical approach supports and changes the way health professionals and patients communicate in the work-related context. World Health Organization Disability Assessment Schedule 2.0, or WHODAS 2.0, a general applicable tool for the assessment of difficulties due to health or mental health conditions. This assessment tool is advised to be used for the collection of disability data on adults aged 18 years and older. Chapter 2, Functioning and Functioning Related. Complexity of components such as the physiological functions of body systems, including physiological functions, anatomical features of parts of the body such as organs, limbs and their components, and the execution of tasks or actions by an individual as such, or the involvement of a person in a life situation. These are subdivided into activities and participation and functions. Chapter 2, Functioning. Activity is defined as execution of a task or actions by an individual. Meanwhile, participation is defined as involvement of a person in a life situation. Chapter 2, Activities and Participation, also includes your self-administered tools like your PCFS and WHODAS 2.0, which you can see at the bottom of the screen. Chapter 2, Functioning. Assess the problem level. Example, the level of impairment of the specified function, not to address an RFE or an episode of care. Describing the nature and assessing the severity of the problem offers the possibility of the follow-up of care and addressing changes over time, such as decrease or an increase of the impairment problem. Example, the RFE is dizziness. It's a symptom or complaint. Chapter 2F, Functioning, describes the level of impairment or to what extent a person experiences dizziness as a problem. Chapter 2 Function has an example at the bottom of the screen, which is the problem scale value. Chapter 2, Functioning and Functioning Related. Functioning related is described as the context in which functioning takes place and how functioning is executed by. It's made up by two. First is environmental factors, which is person lives in the things outside the person. Second is personality functions. One person differs from another person. Remember, person's own perception, not the health professionals. Chapter 3. Chapter 3 is your regional extension. It is based on the frequency of classes and codes in the national and regional primary care registrations. Also, additional classes and codes from the Global Burden of Disease or GBD list needed to achieve the addressing of a worldwide coverage of health problems have been included in the regional extensions. African extension, European extension, South American extension. Chapter 4. Chapter 4, Emergency Codes. Emergency use with the epidemiological importance for risk of national or international spreading of infections. The codes are updated and harmonized in accordance with the ICD-10 and ICD-11 emergency classes whenever relevant. Chapter 5. Chapter 5 is Extension Codes. It is provided as a supplementary codes or additional position to give more detail or meaning to the initial code if so desired. The extension codes are not to be used without an initial code. SV, scale value. TEM, temporality. CAU, causality.
For the benefits of ICPC, it allows patients' health problems to be tracked over time through the recording of episodes of care and by allowing the coding of the reason for encounter through to a recognizable disease or problem and interventions. It reflects the frequency and distribution of health problems commonly encountered in primary care and reflects the way in which primary care providers work to solve problems. It is also simple and easy to use for primary care providers, doctors, nurses, and other allied health professionals, therefore increasing the likelihood of consistent and accurate coding. It complements other classification systems such as ICD and clinical terminology systems such as NOMED-CP and READ codes. It enables meaningful feedback to primary care, enables the exchange of information between primary and secondary care, as well as with policymakers and funders to understand what is happening in primary care and therefore improve the provision of care. For the license, ICPC Foundation's work has two, which is the ICPC-3 sponsorship and ICPC-3 license. ICPC-3 sponsorship, the work of the foundation is made possible by the sponsors. ICPC Foundation do not receive governmental subsidy for maintenance and developments. The foundation offers sponsors the support in the area of methodology in the use of classification and terminology and the knowledge sharing with other users on every possible level of implementation of ICPC-3. Sponsorship is possible through official sponsorship and customized sponsorship. Official sponsorship offers the free right of use of ICPC-3 within a country. Official sponsors are offered the right of translation. With regards to the translation, they have a separate policy. They emphasizes the translation to different languages in any related material, electronic versions, processes, and the committee in charge for the translation process, other changes and extensions that will be done in the classification. Customized sponsorship is sponsoring for a specific purpose such as for research on a specific topic or just to acknowledge the importance of the work of the center. Sponsors can be national institutes, professional colleges, universities, commercial organizations, individuals, etc. For the ICPC 3 license, WONCA offers 3 levels of licensing or sponsorship for high-income countries, middle-income countries, and low-income countries. It depends on the country income level according to GNI per capita of World Bank. Licensing includes a package of official, sponsorship, and support by the ICPC Foundation. Within all 3 forms of licensing, the ICPC-3 is free to be used by any party under a Creative Commons license BY-NB. This includes the free of use of ICPC-3 by commercial parties. A research license is required in case a research institute or university resides in a country without an official sponsorship. The research license can be obtained for free under the condition that as soon as the ICPC-3 is embedded in information systems for other purposes, then research and official sponsorship needs to be in place. Policy on copyright and licensing. The copyright of ICPC-3, both in electronic form and hard copy, is owned by WONCA. This policy relates to the electronic version with the following aim: to allow WONCA to promote, distribute, and support ICPC-3 and further develop it as the best classification for primary care. To maintain international comparability of versions of ICPC-3. To obtain feedback and maintain a clearinghouse of international experiences with ICPC-3. To achieve recognition of WONCA's initiative and expertise in classification. To promote understanding of appropriate links between ICPC-3 and other classification and coding systems, particularly ICD-10, 11, ICF, and ICHI. To encourage use of ICPC-3 rather than inhibit it with restrictions. And lastly is to obtain financial support to enable achievement of these aims and allow the work of the WONCA to continue and expand. For contact, for information on sponsorship or licensing, including for research purposes of ICPC-3, you may check for this address, and these are for references. Thank you and God bless.